church, but I've got this last one, which I think is important and one of the most extensive that I'm going to do. Acetaminophen, and I'm even going to give it a title: Preventing Children's Dosing Errors. This is number 7 on our list. What I'm going to do is I'm going to go through 4 different products with acetaminophen in them. I'm going to go through acetaminophen children's liquid, acetaminophen infants liquid. I'm going through suppositories, and then what you need to watch out for in combination products. And there are too many of them to go over all of them, but you'll understand what I mean when I say you have to be spot on with the age, the dosage form. Every time you get Tylenol for a child, you should absolutely be talking to the pharmacist. This is a complex conversation, and one that you should not be hurrying, one that you should not just throw the Tylenol into the cart because you've seen it before, you've had it before. There are many dosage forms, many ways to mess this up. So again, this is part of the 25 over-the-counter children's medication pronunciations, some additional information in addition to the book. Okay. I'm going to treat them as if we had 4 different videos, but I'm going to put them as one extended video because I think it's so important that we recognize that these 4 products have their own unique, I guess, clinical pearls, things that we really have to worry about. So the first one I'm going to go over is children's Tylenol liquid, and this is what it looks like. And the thing I'm going to really focus on is understanding the mLs and the teaspoonfuls. Teaspoonful is an archaic term. You used to give medicine in teaspoons, but we don't really do that anymore. We do something much more precise, which is to use the metric system and milliliters. So in each 5 milliliters, which translates to 1 teaspoonful, and that's only there because it's really an archaic term, it's 160 milligrams of acetaminophen. And for those of you that haven't used it, it is a pain reliever, fever reducer. It can temporarily reduce fever as long as the drug is active or lasts. It relieves minor aches and pains because of the common cold, flu, headache, sore throat, even toothache. Okay. But when we're looking at this, what we want to notice is that in each 5 mLs, okay, we're going to have 160 milligrams, and we want to dose it with what you'll find in the box. And in the box you should find, on top of the actual bottle, you should find a cup that, and I'm opening mine, you should find a cup that is precise to 5 mLs, 10 mLs, 15 mLs, and the dosing is going to depend on the child. So if you have a 2 to 3 year old, it's 5, 4 to 5, 7.5, 6 to 8, it's 10, 9 to 10, it's 12.5, and 11, it's 15. Okay. The first thing to watch out for is that you never fill a cup up. That's not the purpose of the cup. The cup is to provide precision. It is not an entire dosage form as you might find with something like a Miralax, where you literally fill the cap full to get to 17 grams. So the first lesson, don't just fill the cup up. We're really looking for precision, and we're trying to get to that line that's appropriate. And that cup is so valuable because it has 6 precise lines for 6 precise measurements for these 6 different dosage forms. So don't throw the cup away. Don't just use a teaspoon if you lost the cup. Go get one from the pharmacy. They'll give you one for free. Don't take any chances. Dosing is one of the easiest errors and most common errors that happens with children. Okay, so that's acetaminophen, or children's Tylenol liquid. Acetaminophen infant's Tylenol is a little bit different, and you're going to notice that there's going to be a little bit of different signage, and I want you to notice why. So here we have 5 mLs, and you don't see the word teaspoonful at all, and there's a reason for that, because you should never, ever, especially with infants, use a teaspoon to measure any medicine. It should always be in milliliters. You should always use a syringe, or the product. So again, same thing in terms of conditions that it treats. It's the same ingredient, so it makes sense that we have similar conditions. But what we want to look at is this next slide, which is the side of the infant's Tylenol box. And you'll notice that that 5 ml dosing is only for someone between 2 and 3 years. You say that's very limited. Well, the assumption is that you're going to go on to the liquid or the children's Tylenol or children's acetaminophen if you have someone that's older. And this seems that it's not really helpful, because if you have an infant that's under 2 years old, you have to ask a doctor. The limitation is that when you're talking about over-the-counter medications, what's safe for a patient to use for themselves, the limit generally goes to 2 years, where everything is going to be ask the doctor. But look at this note at the bottom. Use only the enclosed syringe specifically designed for use with this product. Do not use any other dosing device. So again, the syringe, it's a really helpful syringe. It's got graduations from 1 to 5 milliliters, and the nice thing about it is that there's gradations. I'm not sure if that word is right, but there's there's lines at 1.25, 2.5, 3.75, and 5. If the physician says, okay, well, under 2 years, I'm going to ask you to dose at this level, and then you have something that's very specific. And you should have this out while you're talking to the doctor, saying, okay, and then what you'll do is you'll pull the drum back to exactly where it is. And I know that if you have someone of a certain age, they may not be able to talk to you, but I talk through this with my children. You can see my other videos. Anytime I'm dosing them, I always talk about the number to make sure that I'm getting it right. Then I try to ask my wife as well. Okay, so that's acetaminophen, infant's Tylenol. Acetaminophen, pediatric Acephen, is a suppository, and this is going to get even a little bit goofier. So where we saw that 160 milligrams in 5 mLs, now we don't have a liquid measure. So how many milligrams do we have? We have 120 milligrams in this pediatric suppository. And what does that mean? Right? So we have 160 in the one, 120 in the other. Well, when you give something rectally, the absorption is different. Everything changes a little bit. So who is this actually good for? You know, what ages is this good for? And here you have to go to the side, and you see that children 3 to 6 years, it's okay to give every 4 to 6 hours. But if they're under 3 years old, you need to ask the doctor again. Okay, so again, this dosing, the point of the video series is to recognize that dosing is complex. Errors are easy to make, and that you should be asking the physician and you should be asking the pharmacist how to properly use them each time to make sure that there's no mistake. The last one, I'm not going to go over the other ingredients right now. I'll go over them in order as we get to 11 and 20, but I will pronounce them and explain why it's here. So 7 is going to be acetaminophen, 11 is diphenhydramine, you might know it better as Benadryl, Phenylephrine, which you can find in combination products, but also in Mucinex. It's a decongestant. So this is children's Mucinex nighttime multi-symptom cold. And these extension products, brand extension products, are the easiest to make the mistakes because there's a little bit of goofiness with the way the dosing is articulated. There's nothing wrong, it's just a little bit different, and we want to make sure we understand that when you're giving a multi-symptom product, anytime you see more than one ingredient, I think you should always talk to the pharmacist. But always, when you see more than one ingredient, you really want to talk to them, make sure you're getting exactly what you should be getting. So what's it for? And I put in bold, and I'll put it in my highlighter here, my laser pointer. The Tylenol or acetaminophen part is for the minor aches and pains, for the headache, and then temporarily reduces fever. So that's what we're using the acetaminophen for. Okay. But what I want you to notice is that the way that we look at the active ingredients is a little bit different. So where in the infants and the children's we saw 5 mLs, in the suppository we don't have a liquid measure. Here we say in each 10 mLs. So as a pharmacist, I've been doing this a long time. I can immediately see 10 mLs, and the first thing that comes into my mind is, you know what, this is probably for 6 and over. And then you look at the front of the cover and you say, oh, you know what, it is. It's only for someone that's 6 and over. Okay, and that has a lot to do with the other ingredients that are in it. But here we have 325 milligrams of acetaminophen, 12.5 of diphenhydramine, 5 of phenylephrine, and it's only for children 6 years and up. Now, is this much different than the dosing in the ones that we had before? The answer is not really, because if you divide 325 milligrams by 2, you get that there are 162.5 milligrams in each 5 mLs. So this is 2.5 milligrams, which is a very tiny amount of medicine, more than the liquid, than the infants' and the children's liquids. What I just want you to be careful of is now we're looking at dosing in 10 mLs versus 5 mLs and so forth. So again, buyer beware. Talk to the pharmacist. Even if I know the kids are hanging on you. I know the kids are like, let's go home, I'm sick. Or, maybe you don't want to ask for direction. Maybe you don't want to ask because the pharmacist looks like they're busy. This is kind of one of those things like where you're at the restaurant and they have those ones where you can kind of just pull up and ask a question. Well, don't stand in the register line. Don't stand in the drop-off line. Stand at the counseling window. That one line, if there is any, should be a lot quicker. And there's no pharmacist that would ever want you to go home with a children's over-the-counter medicine without talking to them. You want to be absolutely sure when it comes to children's medicines. There's about an error every 8 minutes in the United States. Just please do ask the pharmacist. Okay. And this is acetaminophen, diphenhydramine, phenylephrine, children's Mucinex nighttime multi-symptom cold. Hopefully this will make understanding acetaminophen a little bit easier, and certainly to be more aware of the dangers of dosing with acetaminophen. And then next time we'll move on to ibuprofen, another one of the more common drugs that you'll see in pediatric medicine.